Hi, Dr. Akavan again, and I would like to talk to you about heartburn or gastroesophageal reflux disease known as GERD. Have you ever had this feeling, let's say it's late at night and you ate some heavy fatty food and you go to bed and you feel like this thing in your chest, and you feel like you're nauseous and you want to vomit? It's a very bad, yucky feeling. Or during the day, if you eat something, you feel like food gets stuck in the stomach, or you feel bloated and you have a lot of pain, intense pain that doesn't go away. Sometimes you feel like you're having a heart attack. That is heartburn, and more importantly known as GERD. Now, what is causing heartburn or GERD? Well, if you're overweight, that could definitely cause heartburn for you because it pushes on the stomach and then the acid comes right back up. If you think about it, when you eat food goes through the mouth, through the esophagus, into the stomach, and then the acid has to be produced so it can digest the food. Now, a lot of times the acid comes right back up, as I said. And I just talked about the weight. Now, let's talk about smoking. Could definitely do that. About heavy consumption of alcohol, definitely. Spicy food. My patients tell me all the time, Doctor, I had chile, and that definitely causes a problem. Now, if you eat heavy fatty foods, for sure it causes that. Now, doctor, what do we do if we have heartburn? Well, first, you got to avoid the things that causes the heartburn. If you have overweight problem, you need to lose the weight. If you're obese, you definitely need to lose the weight, under supervision of a doctor. And if you eat spicy food, just stop it. And you have heavy fatty foods, I would definitely stop that as well. What you want to do is you want to eat very small, frequent meals throughout the day so the esophagus is moving all the time. Alcohol I talked about, smoking I talked about. It's also important to know that coffee, chocolate, and mint can also worsen this problem because what they do is they loosen the sphincter from the esophagus into the intestine so the acid comes right back up. So for all those chocolate lovers, you may go back to it at some point in life. For those coffee lovers, you may go back to it at some point in life. But for now, I would say hold it until you feel better. You can definitely take over-the-counter Tums for a day or 2 or 3. But I wouldn't take that beyond that. And there's also a lot of antacid medications over the counter. You may even have gone to a doctor and have been prescribed medication for this problem. But I wouldn't continue forever and ever without getting checked out. Why? Simple. Because all the symptoms are not just symptoms of GERD. They could be masking so many other problems. As I said, an ulcer in the esophagus, or sometimes an ulcer in the stomach can present this way. It's not the most typical presentation, but it could. The other most important problem that somebody can miss is that, God forbid, you could have esophageal cancer, or you could have stomach cancer, or so many other diseases of the chest that could present this way. So, heartburn is simple. The treatment of it is simple, but it's not always easy. I definitely do not recommend that you continue without treatment, and I definitely recommend that you get help of a professional ASAP. In summary, here's Casa de Salud. It is our goal to detect and treat acid reflux as soon as possible. More importantly, at Casa de Salud, we would like to identify those people at risk and prevent its development or delay its onset at all costs with proper diet and exercise.